Welcome to our virtual town hall meeting. We call it a heart-to-heart discussion. Excited about tonight. And Dr. G, Dr. Gao Gao, we call him Dr. G, is no stranger to our station or to our audience. And we really are excited to have him tonight. We're going to be talking about women's health. Welcome, Dr. G.
Thank you. Pleasure to be with you.
Listen, if you are watching via YouTube or Facebook, make sure you comment, right? Comment, ask your questions. We have the experts here tonight. We're going to be talking about women's health. Almost got choked. Women's health tonight, and I'm really excited about it because one of the topics that we really will be discussing is uterine fibroids. And in our community, we have a number of women at alarming rates who suffer with, fibroids. And I love it because Dr. Gao Gao has an amazing, medical practice at the Metro Fibroid Center. And we don't always have to have a hysterectomy. We don't always have to get rid of our uterus because of these fibroids. And so we're going to get right into it, Dr. Gao Gao. So again, if you have any comments, if you have any questions, make sure you leave your questions and comments, and we want to address them tonight. And share, tell everybody about this conversation, share it on your page so we can get this information out. All right, Dr. Gao Gao, we're going to jump right in. First, talk a little bit about your background. I know we're going to get into what you do, but talk about your background and how you came about Metro Fibroid Center.
So I'm an interventional radiologist by training. Yeah, thank you. That's a very good question. Interventional radiologists are sort of a rare breed of physicians. They use technology to do minimally invasive surgery. I trained at Georgetown and the Washington Hospital Center. And actually, I trained with some of the greatest experts in the field of minimally invasive surgery. So I was lucky to have been there when this whole thing about embolization and fibroids and all that was taking off. So basically, I grew with it. So after that, I was chief of radiology and interventional radiology services at Southern Maryland Hospital for almost 10 years. Then, when we understood a lot of things about these procedures, the technology behind it, and it has matured to a point where it can be taken outside the hospital, we decided, why don't we just do that? Why do patients have to stay at the hospital for these procedures? Because the majority of those patients who do have fibroids are healthy patients with an issue rather than really sick patients. So we decided we're going to create the first and most comprehensive center that deals specifically with women's issues, specifically the fibroids, the adenomyosis, the pelvic congestion syndrome. And it's been a blessing since then. We've been able to help a great deal of women in the community and educate a lot of patients about the disease process, the technology, the treatment available to them. And like you said, that has carried the message out, and now a lot of patients who are offered those traditional surgeries like hysterectomies and myomectomies as first option, they know that there are other options available to them, and they are much better advocates for themselves than it was like basically 10, 15 years ago.
That's so good. Yeah. So how common are uterine fibroids? I'm literally living with them myself.
Oh, wow.
So how common are they?
Well, here's the thing. The majority of women, about 80% of women really, will experience something related to fibroids in their lifetime. These are usually benign tumors, benign growths. And so by themselves, they're harmless. They don't behave like cancer or anything like that. Mm-hmm. But at the same time, if they grow to a certain size, if they breach into the wall and all that, they can cause other symptoms. And those complications are what we're trying to, deal with. So fibroids are very common. Almost 80% of women will have them. Mm-hmm. But we only treat patients who are symptomatic, who do have symptoms, whether it's bleeding, pain, and all the other, symptoms that, are now very well known. And those are usually about 25 to 30% of the 80% we talked about. So if you have fibroids, but you don't have any symptoms, not even you don't feel it in the belly, you don't have any other symptoms, don't do anything about it.
Right.
Once you start having symptoms, then go ahead and seek treatment for that.
Got it. And that's the position I'm in. I have no symptoms. I didn't even know I had them, of course, until we did
Yeah,
pap smears and that type of thing.
correct.
And then we saw them. But I'm a woman of a certain age too, so it hasn't affected me. And so I'm not sure if they're growing, but my OBGYN, of course, watches them just to
Mhm.
make sure that they are not causing any complications. So
Correct.
what are the advantages of fibroid embolization over the treatment
Mhm.
modalities? I know that I've had friends who had to have hysterectomies. I know
Correct.
friends
Yeah.
who had to not be able to have children and that type of thing because of where the fibroids were positioned and that kind of thing. So talk a little bit about fibroid embolization over other
Mhm.
treatments.
Yeah. So just to go back a little bit in history, like, just maybe 25, 30, 40 years ago, the only option was available to patients with fibroids and symptoms from their fibroids were basically hysterectomies and myomectomies. Hysterectomy means removing the uterus. It doesn't matter whether it's called partial or not, it's still a hysterectomy. And myomectomy, which is the removal of just the fibroids, the ones that are actually accessible are removed. But later on, as we understood the pathophysiology behind these tumors, these fibroids, we realized they depend a lot on the vascular supply coming to the uterus. They basically hijack blood flow from the body,
Oh,
and that's how they grow, and that's how they compress other organs. And if they breach through the cavity, now you're bleeding all the time, and you have all the anemia and everything that follows those kind of
mhm.
symptoms. So when we realize that the new kind of medicine is how can you get the body to catch up to the disease process, because the body can do it better than any technology that we have. So hysterectomy and myomectomy, very traditional, very invasive. You just go in, remove the organ, even though the organ itself is okay, is normal, but it does have fibroids. So that's why it was thought of as a very aggressive, procedure, especially that in the US, there's almost 650,000 hysterectomies done every
Wow.
year. And the Lancet in 2017 published a good review where they realized that 75% of those hysterectomies were really unnecessary. And the
Wow.
majority of them were done for fibroids. So really, hysterectomy should be reserved for patients who have malignancies like cancer, stuff
Mhm,
that
mhm.
needs to get out of the body, immediately. So over time, we realized that what if we do targeted treatments instead of just going and being invasive and opening up the patient? Why don't we do targeted treatment, something that would target the fibroids, the tumors, but does not touch the normal uterus?
Mhm.
So the uterus itself is normal, but it does have these little masses that grow, over time. So that's where embolization, came about. How did that happen? It was, a funny story behind it. In France, they were doing embolizations to stop bleeding on patients who were giving birth and they had hemorrhage right after birth.
Mhm.
And they realized this was like in the early 90s. They realized that when they did the embolization to stop the bleeding, women that had fibroids, their fibroids just melted, just disappeared, and their symptoms improved. So they said, hey, we can use this for the fibroids. Why do we just use it for the bleeding? And we used embolization during my training and during my career. We used embolization a lot for trauma, for example,
Mm.
vehicle accidents and trauma in general. We would use embolization to stop the bleeding to save patients. So that principle behind the embolization, which is blocking the blood supply to the tumors, sort of like if you stop watering a plant and then it
Right.
goes down on its own. That's what it is. The disease process in fibroids, disease process in many diseases goes, if I were to give an analogy, it goes like at 100 miles an hour. But the immune system and the body is slow to catch up, and for a good reason. You don't want all your immune system to go haywire. So with the embolization, what we do is we go in very, very targeted surgery. And we go all the way to the door of the fibroid, and then we release medications specifically to just the fibroids. And the immune system catches up. It's like slowing down the disease process. The immune system catches up, and the body does the rest.
Wow.
You can't do it better than that. So why is embolization extremely important? Is because it avoids you heavy surgery. Because like I said earlier, the majority of our patients, they are healthy patients. They're not like sick patients. So if we can keep them out of the hospital, if we can keep them from having heavy surgery, that's very good. Number two, it is a permanent treatment. When you do the treatment, this is not something that is temporary, like you were doing a myomectomy or doing an ablation. This is a permanent treatment. Once you get it, you're done. Think of it like the iPhone or the Tesla of surgery, basically. That's what it is. So it has so many advantages, including the fact that it's a same-day surgery. The downtime is about 5 to 7 days. I've had patients who are running within 2-3 days, believe it or not. So all in all, in my opinion, my professional opinion, every patient that has fibroids that are symptomatic should first look into embolization and leave the other options for situations where you did everything and worked. But the likelihood of that happening is very low. So consider embolization first, because that's going to save you complications, save you downtime, save you too much medications, save you a hospital stay, save you money. It's cost effective. And at the same time, you don't have any major workday loss.
That's right.
If you go for this conventional surgery methods, you're out for 2 months, really. Too much.
Especially that's a major surgery. And like I said, I've known too many women who had to have had, a hysterectomy long before they could have their children and that kind of thing. And so it's really, really sad. And I love, it's almost like it's too good to be true, right? Like, but the advantage of what you could do is out there. Now, when you have fibroids, Dr. G, what are some symptoms that we need to look for?
So the symptoms could be as insidious as just the belly getting bigger, or maybe if somebody is laying down on a bed or on a couch and then they touch their belly, they can feel like there's some masses under the skin. That is a symptom on its own. Sometimes patients, they're like completely okay, but they look like they are pregnant.
I've seen it.
Pushing forward. Some of the most common symptoms will be like heavy bleeding during the period. Many patients also bleed between periods. We can have a lot of cramping because the fibroids, think of it, you have a normal uterus that is trying to do its, physiology, its thing, but it has these balls, these tumors in the midst. So the fibers, when contracting, cause a lot of pain because you have to squeeze through, big masses. You can have back pain because fibroids can touch the spine. They can push the small bowel and the rest of the organs up, and then you have all this bloating, and you feel like, you have a little drink, and next thing you know, your belly is full. You eat a little bit, and your belly is full.
Right.
Yeah, you can have this discomfort driving, discomfort sitting down, watching a movie, and a host of other, issues like intimacy could be affected. And these symptoms, unfortunately, sometimes they don't make sense together. So the patient keeps being sent from one doctor to the other. Now, if you have back pain, has nothing to do with, for example, constipation, has nothing to do with the heartburn,
right?
Has nothing to do with bleeding. So now you go into the back doctor. Now you have migraines, and now you go into the neurologist to know that. While in fact, if you can just put 2 and 2 together, you figure out that it's all due to what's
the
fibroids. And if you get anemic from too much bleeding,
because I do know a lot of people get that heavy bleeding from it.
When you get anemic, you get systemic symptoms now. So you're weak, you can't do anything, you're short of breath, you're irritable, you don't want to talk to anybody, you don't want to go out. I even saw patients put on antidepressants because they were so miserable with their symptoms. Everybody thought that they were depressed. Especially sometimes it's hard to talk about the symptoms.
So Kima Archibald is asking, is frequent urination a symptom?
Correct. I was going to get to that because one of the symptoms that can be debilitating is the urinary frequency, where patients either go to the bathroom all the time, or they go to the bathroom, but then they feel like they haven't emptied completely, and then they have to run back. Sometimes they are having, dinner with friends or with family, and they have to get up table and go to the bathroom so many times. Yeah, that could be one of the most debilitating symptoms. And usually when you get to that point, that means that the fibroids either have too many or they are so big that they're now squishing the bladder, and the bladder cannot withstand that much, pressure. And so, it can wake you up at night so many times. You drink just a sip of water and then you have to run to the bathroom. So yeah, it's a good point.
That's a symptom as well.
Yeah.
So if you're having any of those symptoms, if you know you have fibroids and you're just been avoiding a hysterectomy, I would suggest you go to the Metro Fibroid Center and get checked to see if it's something that they can do with the embolization on your behalf. You don't know how serious it is, or at least get checked to see if they can do something about it. If you have any questions, don't forget, if you're on YouTube or Facebook, address those questions to Dr. G, and we want to make sure that we answer all the questions that you have. If maybe it's your wife or your spouse or somebody you know who might be going through it, then of course we want to hear from you as well. Now, when there are fibroids, who should be treated and who should not? I know you talked about those who don't have symptoms. Like I don't have any symptoms, and my OBGYN has been, watching me closely. I still feel like, Dr. G, I should probably come see you though. I just want to make sure. Even though I don't know that there are any complications, I just want to make sure that that it's fine, that I might not have to do the embolization, but it might be something that I should do. So I think I still should come see you.
Well, I mean, theoretically, if you were to look at it, if you have fibroids, even if you don't have symptoms, you would probably think that it's better to be treated than not be treated. But think about this: if you have between 70 and 80% of women with fibroids, we don't want to, be treating basically every woman. Yeah. So it makes sense, first of all, to differentiate patients who do have symptoms and patients who don't have symptoms. If you don't have symptoms, do not bother with it, because what are we going to do? You're already feeling quote unquote normal. So we're not going to help you by doing a treatment, So your fibroids may just decide they're not going to grow any further. Or your fibroid may decide they're just going to bug you just a little bit, and maybe you can handle that with some medication or something very conservative. So the least we can do, the better in terms of invasiveness and procedures and testing and all that. But on the other hand, the 25 to 30% of those 80% we talked about that do have real symptoms, those are the ones we worry about, because they have very overt, very frank symptoms, but they still don't do anything about it. You don't want to wait to the situation where now you have systemic symptoms and you're dealing with other issues. You can't go to work, you can't do so many things, and it's affecting your life. The quality of life becomes like so poor that sometimes you would accept any kind of treatment that is offered to you. And we don't want the patients to get to that point. Know that you do have support. Know that there are a lot of options out there. You just need to be advocate for yourself and ask what your options are. Never accept just one option over the other. Ask what your options are. But personally, I think that every woman with fibroids that are symptomatic should look into embolization first before looking into any other treatment. And if the interventional radiologist, the Metro Fibroid Center decides that you do actually need the conventional surgery, then you're going in a step ladder. Instead of jumping for, the heavy gun, you're just going in a step ladder, in step fashion. That way you save yourself a lot of unnecessary procedures and a lot of unnecessary surgeries. So yeah, the most important part is whether you're having symptoms or you don't. Sometimes you hear, well, you're close to menopause. When you get into menopause, your fibroids are going to go away. I've seen many cases where it's not the case. That doesn't work all the time. I've seen situations where patients are told, oh, your fibroids are too small. We just don't worry about it. No, they can be too small or too big. It doesn't matter. As long as you have symptoms, you have the right to be treated and you should seek treatment. That's extremely important. It's better to be treated where your symptoms are under control and maybe local to your pelvis, rather than when you get to a point where now you need transfusions, you need iron infusions, you need, ER visits, and so a lot, of stuff that could be going on. So remember, no symptoms, don't do anything about it. Symptoms, seek treatment regardless of what you're told. And one of the symptoms that it's most of the time overlooked is when your belly starts enlarging and you're told you have fibroid. That is a symptom, even though you don't have bleeding, even though you don't have back
Got it.
pain. If the belly is enlarging, that is a symptom by itself. Seek help.
And that's why I said I think I should come because I'm in that premenopausal stage. So my body is making changes. I want to make sure that none of those changes are because of those fibroids. It is because I'm a woman of a certain age. So I think that for that reason too. And like you said, I go to my OBGYN, frequently, regularly. So so that we're watching them. And I think that's the most thing, is to know your body, know what's going on with your body, and know what seems to be a little different than others. So how should patients seek help when they have fibroids? Because like you said, some doctors will just say, if you're living with it, it's okay, but you still have any symptoms and things. So how should patients seek help when they're going through?
So you'll run into a couple situations. There's a situation where a patient does not realize that their symptoms are actually due to fibroids, because women tend to be tougher than men, so they get used to their symptoms.
Say that again.
So sometimes I get patients like they say, like, oh, my cycle is normal, it's only 5 days, but then when we get into much more deeper questions and we discuss the situation, we realize that's actually heavy bleeding. It's just the patient got used to it. And so,
yes,
it's not until they start getting the systemic symptoms like shortness of breath, the tiredness and all that, then they start, seeking help. So that's one situation. Another situation would be a patient that goes to the emergency room or to their, doctor's office, and, they do an ultrasound for something else, or they do an examination for something else. And they say, oh, you have fibroids, but they don't have, any symptoms. So the other category would be the patients who are already into the stage of complications, but they just never been pointed to the right direction. Now they have like this severe back pain, it's pushing against their spine, but they've always been getting these injections on their back and all that. So this is how I would proceed. If you don't have any symptoms and this was discovered just on an incidental ultrasound or some sort of examination, but you have no heavy bleeding, your cycle is not like 6, 7, 8 days, you're not using too many pads, and if you don't have any urinary frequency, you don't have any abdominal pain, your belly is not big, you don't have any bloating, no constipation, no urinary frequency, no back pain, then don't do anything about it. You do have the information, now you have the intelligence, and then just do your well-being visits. And if you start having any of those symptoms we just mentioned, then first thing to do is to find a fibroid specialist near you, especially interventional radiologists. Talk to them. Say, hey, what can you do for me so I can avoid surgery? If they have something that they can offer you, and they will discuss that with you. If they examine you and they talk to you and they figure out through MRIs or through ultrasounds or whatever testing they're going to do that actually you need more invasive surgery, they will point you in the right direction. What I see more often is the opposite. So now you have a patient with the symptoms, and then the first thing that is thrown at them is hysterectomy, myomectomy. Now, a patient that is desperate with those symptoms, obviously, just get me better. So they will, take those, options very seriously, but they're not. The embolization is not mentioned very often.
I was going to ask you, why is hysterectomy so widespread? Like the first thing, they say is, okay, this is
Yeah.
what's going on. And I've also heard that it depends on where it's positioned, right? So I've heard people saying, oh, I had to get a hysterectomy because of where it was positioned. It
No.
was over one of my ovaries, so they had to take
Yeah.
everything. It was this. Talk a
Wow.
little bit about that. Is that a thing, or is embolization still an option?
No, embolization is always an option. It's
Got
always,
it.
there's no limit per se to what embolization can do. Actually, it can be an adjunct to other procedures. Let's say, for example, we have a patient that still wants to have kids, or a patient that has like a very big uterus, but they don't want to lose their uterus. So it's a lot of fibroids. We can always do a combination of treatment. We can do the embolization and then follow it with some, embolization can make heavy surgery a minimally invasive surgery.
Got it.
So sometimes patients who choose, let's say patient chooses hysterectomy, even though they've been talked to, about all their options, including the embolization, but they still want to do a hysterectomy. Embolization can be done before the hysterectomy to make sure instead of being on the table for 5 hours, then it's much lesser time. Recovery time is much quicker because there's not going to be that much bleeding during the surgery if you had the embolization ahead of time. Yeah, and then your recovery may be faster.
Got
So
it.
we do that in many situations, with our gynecologists. So the hysterectomy is very prevalent because that was the only option available basically 40, 50 years ago. Is either the hysterectomy or you had to deal with your symptoms. So that trickled down sort of like mainstream teaching that when somebody has fibroids, they don't want children, they completed their families, then go ahead and do the hysterectomy. But if you look at the medical indications for all those types of surgeries, whether you're doing hysterectomy, myomectomy, ablation, embolization, there's no such thing as you don't want to have kids anymore, let's do a hysterectomy. Because otherwise we'll be doing hysterectomies right and left, or we'll be doing procedures right and left. That's why we talk in the first place about if you don't have symptoms, don't bother with treatment. You don't want to do unnecessary procedures.
Right.
But in the era of technology today, when we have all these other options available to us, it is unfair that the patient is offered a hysterectomy as a first option. Hysterectomy should be
That's
your
unfair.
last ditch. When we did everything and nothing worked, then maybe we can say, hey, we tried everything, nothing worked. How many times did I see that situation? 0. I've never seen that. So embolization, anybody can be a good candidate for embolization. They just need to do the due diligence for themselves and be advocate for themselves and find, a doctor that specializes in that. In the scenario where the patient does not have any symptoms, don't do anything. In the scenario where the patient has already been, reached the complication stage, the embolization can actually be a lifesaver because you can get patient back to normal, then think about what needs to be done, next.
Got it.
Yeah. So it's
One of our viewers have a holistic approach. I want you to address this because not all holistic approaches work, but Kima Archibald says a plant medication with vapor boiling under the vagina I thought was a treatment. Is that a treatment for fibroids?
It's a good question because I see this, it's very prevalent. We have a lot of patients that use
Holistic medicine.
Holistic medicine. Now, as a physician, I have to go by evidence-based. I have to go by stuff that's been tried in trials and, tested and was approved by the agencies, the FDA and all that. So I'm pretty sure there may be some psychological aspect to using holistic medicine, which can be very helpful. Now, can I recommend this kind of treatment? I personally can't. I personally can't recommend that kind of treatment because I don't have any data that tells me that it actually has been,
that which is proven, right?
Yeah, to work or to do. Now, sometimes, if you go by treatments that are not evidence-based, you may actually cause more harm than good. And our job is do less harm, right? Do no harm, actually. Do no harm. So I respect, patients' choices, and if they want to look into that, but I cannot, vouch for this kind of treatment because I have no data on that. Nothing to back it. If I offer something to a patient, I have to be able to back it up with some good science, good data.
Right. And the research that goes behind it, making sure that you follow suit. I know that in working with St. Jude, which is a research hospital, the procedures that they go through to have all these doctors do these different trials and tests that you guys can use and practice on with other patients, which is why about embolization against the hysterectomy because of how you studied it, right? Because of you coming in that era of watching the research, seeing the results of it, and now for many years, seeing the success of it.
If you just look, for example, at the history of embolization by itself, the first time when we started doing the embolization, we didn't just jump and started treating every patient that came to us. We were extremely selective about who could have it. It was only patients who completed their families, patients 35 or older, patients who understood the risks and benefits of a new procedure. And we proceeded in a stepwise fashion. And as the data trickled in, and we have solid, numbers and evidence to show, then we expanded it to more patients. That's how science works. That's how evidence-based medicine works. Because the last thing we want to do is just be, jump on procedures, jump on medications, and next thing you know, we have a disaster in society. That's the last thing we want to do. So if you're considering taking, herbal medicine or a holistic approach and all that, do some research about it. Talk to people who had it. Did it help them? Did it not help them? And I know for a fact that if you try something outside of conventional medicine, it may have some psychological aspect to it. Let's not forget, the mind is a very important component of the whole thing. So meditation, for example, could be a good non-conventional medicine, treatment. Meditation helps a lot, So this kind of things, but nothing that I can advise you to take by mouth or inject it or anything like that.
Got it. Yeah. So if you have any questions, guys, from the audience, welcome to the heart-to-heart discussion and ask Dr. G. Dr. Galga has a lot of, history behind fibroids, embolization, about how to eradicate it, how to live with it, how to live without it, how to not have to get a full hysterectomy. In young patients who still desire to have children, which treatment option can still maintain fertility?
Okay. So,
excuse me.
Yeah. So when we started doing embolization, this was years back, we definitely excluded anybody that still wanted to, have children, because we didn't know what the effect of the embolization of the medications that we started using on the ovaries, on the hormones, on the uterus itself, and so on. But as data was being gathered, we realized that there are actually patients who did have embolization. They did not even plan. They were not concerned about pregnancy, and they ended up being pregnant. And there were patients who tried everything to get pregnant, but they couldn't. When they had embolization, they became pregnant. Now, if you have fibroids and you're considering your childbearing age and you're considering having kids, there's only two procedures you should consider, and not other. One is the embolization, and the other one is the myomectomy, removal of just the fibroids. Now, before you even embark in deciding which one you're going to get, make sure your doctor orders an MRI and you get a full picture of what's going on in the pelvis and in the uterus specifically, and with the ovaries. So that way, the question is not which procedure is good for childbearing age woman and which one is not. is which one will give you the maximum benefit with the lowest risk possible. That's how you pick which procedure would work for you. But in general, stick to either embolization or myomectomy, or a combination of both. We had a lot of patients who have gotten pregnant by doing a combination of embolization and myomectomy. It's a teamwork, basically, between gynecologists and interventionalists.
So embolization is targeting the fibroid, and then myomectomy is removing it. Is that how it is?
Yeah. So you have three types. The most popular types of treatment for the fibroids. You have the hysterectomy, which is removing the uterus. Now they like to call it partial hysterectomy and all that, but in fact, it's just a hysterectomy. The uterus is out. That's a definitive treatment. Now you have a temporary treatment, which is called the myomectomy. Now, myomectomy could be an excellent choice. Say, for example, there's only one fibroid. It's on the outside of the uterus. Patient still wants to have kids. There's nothing affecting the lining, nothing affecting the muscle. Yeah, do myomectomy, have babies, and then later decide on a more permanent treatment.
Got it.
So, yeah, with the myomectomy, which is the removal of the fibroids, obviously you cannot remove all the fibroids. Some of them are going to stay behind. So you don't have that gift of time. You have to get pregnant within the following year after your myomectomy, after the removal of the fiber. Otherwise, the little ones, or the ones that we don't see yet, will take over, and we're back to square one.
Got it.
Right. The other treatment, which is the embolization, that's like the technology version of the hysterectomy. You target all the fibroids, you get rid of all the fibroids without touching the normal uterus. So these are the differences between the three. Hysterectomy and embolization are permanent treatments. Myomectomy is a temporary treatment. But if you talk to an interventional radiologist, they will tell you what's a best approach for your case. If you go to somebody with good experience in this field, they will help you out.
So finally, before we close out, you've been talking about it, but how successful is embolization in treating uterine fibroids?
Well, embolization is of all the procedures, I've done tons of procedures in my career, and I can tell you, embolization is one of the most gratifying and the most successful procedure. That it has all the good points you want to see in a procedure: quick, fast, safe, cost-effective, no downtime, and very, very successful, very effective. We've never had a failure in our practice.
Wow.
Every single patient that we've done, we've been able to help them, regardless of how complex the case is. Simply because we work also in tandem with our gynecologists. We work as a team. So we don't just see a patient and then, if we can't do anything for them, we just release them. We talk to our doctors. We try to find options for them, combination of treatment and so on. But embolization is a very, very successful procedure. If it's done the right way, and if you go to the right place, you will be very pleased with the results.
I love it. So if you don't have any more questions from our Facebook page, from our YouTube page, we'll give you opportunity, if you do have one, to share it now so that we can address that with Dr. Galgal. You don't have anything to do with allergies, do you, Dr. Galgal? Because I got this coughing frenzy from
I know, with this weather, one day is 70 degrees. The other
I know. So if you have any questions before we go to ask Dr. G, you can do that at this time. If not, we're going to close out. But I do want to give you opportunity. Now, for more information about Dr. G and his the Metro Fibroid Center, here's the information scrolling at the bottom, metrofibroidcenter.com, or call 240-244-2302 to find out more information. If you, like me, if you've had a doctor that said that you have fibroids and you see symptoms and you have symptoms, go and do a double check with Dr. G. Go do a double check at the Metro Fibroid Center. If you have no symptoms and it's not bothering you, fine. Dr. G said it's good. You're living with it. But for people like me who's going through premenopausal, my body's changing anyway. I want to make sure that none of these fibroids are the reason why I'm going through what I'm going through.
Right.
You can still go and get checked and get information that you need. And maybe, like you said, if you have a high tolerance for pain, or if you feel like your cycle has been heavy all your life and you just feel like, oh, I'm good, but maybe the fibroids are the reason why. These are reasons to call the number. These are reasons to go to see Dr. G and his team at the Metro Fibroid Center. This has been great conversation, Dr. G. I really appreciate it. He's a part of our Radio 1 family. He's been advertising with us for a number of years, and I just feel like family when you hear Dr. Gal and you hear his commercials on the air, and you see how he interacts and want to speak directly to our viewers and our listeners. We become family.
Absolutely.
So I appreciate you. We trust you, of course, and all the information that you shared today. And so I don't see that we have any further questions. So if you have any further comments you'd like to share or any last words, we'll do that before we close out.
Very good. So I just want to tell your audience that, know that with, current technology, you do have all the help you need if you're having any issues with fibroids or any woman issue. The technology and the medications and the research has gotten so sophisticated. It's amazing how many things are there at your disposal. Ask questions. Don't be shy. Don't hesitate. Go for a second opinion, for a third opinion, and compare the options that you have. Always compare the options that you have and go in a stepwise fashion from the least invasive to the more invasive, and never the opposite, because that way you can control, you're in the driver's seat and you can control what's being done and so on. So yeah, anytime, call us, come see us. We'll be happy to help you.
Awesome. This has been a great discussion. Thank you so much, Dr. G. Thank you so much to your team. Again, guys, go to metrofibroidcenter.com or call the number 240-244-2302. If you have fibroids, if you have symptoms, even if you don't, even if you see something changing in your body while you have these fibroids, this is the way. And I love how Dr. G said, don't go through the major surgeries first. Find out ways that you can have treatment the best way that fits your body. And the best way to do that is go to Metro Fibroid Center. Thank you, sir. We appreciate you tonight. And thank you to all our viewers and listeners. We appreciate you as well. Don't forget to share this on your page. All this information is great to share. That's our heart-to-heart discussion tonight. I'm Cheryl Jackson. Have a great night.
Thank you, too.